Welcome to today's video where we'll be exploring diverticulosis, a common condition affecting the digestive system. We'll break down what it is, why it happens, how it's diagnosed, and what you can do about it. So, let's dive in and unravel the mysteries of diverticulosis. So, what exactly causes diverticulosis? The primary culprit is believed to be a diet low in fiber. Fiber adds bulk to your stool, making it easier to pass. Without enough fiber, the colon has to work harder, creating increased pressure inside. Over time, this pressure can cause small pouches, called diverticula, to form at weak spots in the colon wall. Other contributing factors might include aging, genetics, and lifestyle choices like smoking and lack of exercise. Now let's talk about the pathophysiology of diverticulosis, or how it develops. Imagine the colon as a muscular tube responsible for processing waste. When the colon contracts to move stool along, the pressure inside can rise, especially if the stool is hard and difficult to pass due to a lack of fiber. This increased pressure forces the inner lining of the colon to push through weak areas in the muscular wall, creating small, bulging pockets called diverticula. These pouches are most commonly found in the sigmoid colon, the lower part of the large intestine. While these pouches are present, it is considered diverticulosis. Once they become inflamed or infected, the condition becomes diverticulitis. Diverticulosis is incredibly common, particularly in Western countries. It affects a significant portion of the population, especially as people age. Studies suggest that about half of all people over the age of 60 have diverticulosis, and the prevalence increases with age. While many people with diverticulosis never experience symptoms, the risk of developing complications like diverticulitis increases with age. The tricky thing about diverticulosis is that many people don't even know they have it. In fact, most individuals with diverticulosis are asymptomatic, meaning they experience no symptoms at all. However, some people may experience mild symptoms such as abdominal cramps, bloating, or constipation. These symptoms can be quite vague and easily attributed to other digestive issues. It's important to remember that diverticulosis only becomes problematic when the diverticula become inflamed or infected, leading to diverticulitis, which presents with more pronounced symptoms. Diagnosing diverticulosis usually involves a combination of medical history, physical examination, and diagnostic tests. Since many people are asymptomatic, it's often discovered incidentally during a routine colonoscopy, which is a procedure where a long, flexible tube with a camera is inserted into the rectum to visualize the colon. Other diagnostic tools include sigmoidoscopy, a similar procedure that examines only the lower portion of the colon, and barium enema, where barium is used to coat the colon for X-ray imaging. These tests help doctors identify the presence and extent of diverticula. Diverticulosis doesn't really have specific classifications or types in the traditional sense. The key distinction lies in whether the diverticula are simply present, diverticulosis, or whether they've become inflamed or infected, diverticulitis. Diverticulitis can further be classified based on its severity and complications, but diverticulosis itself is generally just a diagnosis of the presence of these pouches. The treatment and management of diverticulosis primarily focuses on preventing complications and managing symptoms. For asymptomatic individuals, the main recommendation is to increase dietary fiber intake. This helps to soften stools, reduce pressure in the colon, and prevent the formation of new diverticula. For those experiencing mild symptoms, a high-fiber diet, along with adequate fluid intake, can often provide relief. In some cases, doctors may recommend fiber supplements. It's important to discuss any significant changes in diet or supplement use with your doctor. Preventing diverticulosis largely revolves around adopting a healthy lifestyle. As we've discussed, a high-fiber diet is crucial. Aim for at least 25 to 30 grams of fiber per day from sources like fruits, vegetables, whole grains, and legumes. Staying hydrated is also essential for maintaining soft stools. Regular exercise can help promote healthy bowel function and reduce pressure in the colon. Finally, avoiding smoking can also contribute to overall gut health. The prognosis for diverticulosis is generally good, especially if it's managed with a high-fiber diet and healthy lifestyle choices. Many people with diverticulosis never experience any complications. However, it's important to be aware of the risk of diverticulitis and seek medical attention if you develop symptoms like severe abdominal pain, fever, or changes in bowel habits. Recent research focuses on understanding the role of gut bacteria in diverticulosis and exploring potential new treatments targeting the gut microbiome. Studies are also investigating the effectiveness of different types of fiber and the long-term impact of lifestyle modifications. As research progresses, we can expect to see even more effective strategies for preventing and managing diverticulosis in the future.